Hello, class. I wanted to, before we go any further with our interventions and PICO paper, your intervention topic for the paper, I wanted to provide some additional education into what we have done already. And this could be a lack of providing you detailed information during the first day of class whenever I explain the syllabus. I also would like to describe some more in detail about PICO and how you go about determining that. Now, after looking at interventions and submissions, there may be a little bit of a confusion related to what was expected as far as what you turn in the discussion board. And that included your PICO research question about what you're going to research, and it also included 2 articles based on that research. And along with those 2 articles was an annotated bibliography or a summary type information along with those articles. Now, first I want to go over what PICO means and the reason why we use PICO for this type of assignment. PICO it helps you with describing your research, and it helps you to minimize your question, break down your question with what you're doing as far as your research is concerned. The reason why we do PICO is because it's usually a clinically based format for clinicians, and that's what we've done from a clinical standpoint, so we can determine interventions and what works best. When we think about evidence-based practice, this is what helps clinicians determine which one is going to work for the patient. So PICO, the P for PICO is going to be your population or your people of interest, your population of interest or your patient, and it would be described under like your sample of subjects, who you might recruit if you were doing this real, because your assignment is kind of a hypothetical and an idea of your intervention paper. So say that you want to do diabetics. So your population or your people of interest or your patient of interest would be diabetic patient. The intervention, the I out of PICO, refers to the treatment that will be used, that will be provided to the subjects. So if you want to do with diabetics, you want to do weight loss versus exercise for non-insulin dependent diabetes, those would be your interventions, your 2 interventions. Now, the one that you would put in your PICO would be whichever one that you determine as maybe the preferred, or where your standpoint is, or your position of what it's going to be. So let's say with my diabetic patient, we're going to use the intervention of weight loss. And that's what you would put for your I. So for your research question, you're going to say, my research is based on diabetics who are using 2 different interventions. One is weight loss and the other is exercise. And based on the information, the outcome would be those with weight loss do have better outcomes, or vice versa, whichever one you choose. Now, if this was an actual research study, that outcome would probably fall under what your hypothesis is going to be. So if you were doing an actual study, your population would be diabetes, your intervention would be weight loss versus exercise, and my hypothesis would be that those who do exercise in the non-insulin dependent diabetes patients would have better outcomes than those who just did weight loss. And that would be your hypothesis, and then you would do your study based on that. So what your question is, whenever you're going to turn in this paper, is going to be your population, your interventions, your comparison intervention, and then your possible outcome, what you think the outcome is going to be, or your outcome. You can describe the outcome. And that's how you're going to write your paper. And it follows the directions that are within your syllabus, prescribe that pretty specifically. So outcomes, so the C for comparison, if I didn't go over that already, is comparison identifies what you plan on using as a reference group to compare with your treatment intervention. Many study designs refer to this as a control group. If an existing treatment is considered the gold standard, then this should be the comparison group. Your outcome, which is the O in PICO, represents what result you plan on measuring to examine the effectiveness of your intervention. and make sure you are familiar and you validate the outcome measurement. So if you were reviewing research, that's how you would determine what the outcome is, by validation and outcomes. Now, there were a few submissions that were not specific to nursing interventions. So I'm going to ask that those of you who I send out information to, you will need to reconsider your interventions and make sure that they are nursing based, because we do want to make sure that you are able to perform the interventions or prescribe the interventions based on your diagnosis, and they would have to be under nursing interventions. Now, some examples include versus silver-based wound dressings for high risk for infection of wounds, and aerobic exercise versus mindfulness-based cognitive therapy and social anxiety disorder, yoga versus mindfulness activities for stress relief, school versus home interventions in obesity reduction. I'll implement those interventions. What I'm going to show you here is another thing that you can provide to help you along with your PICO determinations on PICO. And it's a great website, and it's called TRIP Database, and I'm going to pull that up here in just a second. It's TRIP, T-R-I-P database, and if you can see it right there, tripdatabase.com, and if you click on that, you can put that in there. And what you see here is I have some information already in there, but if you see right here where it says PICO search, this is going to help you to find out if you have enough evidence that you're going to be able to do your research on this. So here should help you out with this. You have your population, which will do diabetics. So we'll do diabetics. And then we have an intervention. So let's do weight loss, like I told you a while ago. Then we'll come down here and do a comparison, which would be exercise. And then the outcome is going to be decreased blood sugar. Decreased blood sugars. Okay, so that would be like our outcomes. That's how with either one of them, we hope which one's going to work best. So then we do a search, and it's going to come up with, it should come up with several different, we don't want that. It should come up with several different research studies or already things that are already done. So right here you have 1, 2, 3 primary research studies that have identified the same PICO question. So that means there's enough evidence out there. So you could probably find some more evidence, and you can probably take these articles and look through EBSCOhost on the University of Tulsa's website, library website, and you could probably pull up these same articles. However, this 1995 one is probably too outdated, but these two up here should be good. And you can see some evidence-based synopsis and some ongoing clinical trials. So this is effective topic, and you could probably use that to find information. And that's how we need to determine our PICO. So for the assignment that we have there, what I want you to do, if I'm going to be sending out some emails to those of you who need to change their topics, and send me some more information. And also, if you could go and look to see if you actually wrote a PICO question that is related to your research that you're going to do. For example, yoga versus exercise for relief of depression. Then please go in and put that into the discussion board so that I can grade it appropriately. The other thing is, I'm not going to count off for this being late. What I'm going to do is give you the opportunity to make changes, and if everything, you have until Monday morning at 8 a.m. to turn everything in. So that should give you plenty of time to make changes and fix what you've already done, or change it or make it more relevant to nursing. And as always, if you have questions or what have you, please, text me or call me or come by my office, and we can sit down and have a discussion about where exactly we need to focus in on. Questions, please let me know. Talk to you soon. Thank you.